back. My name is mckenzie and I'm a carer, or perhaps a mental health carer. Now, as usual, I want to try and make this clear, as I try and do with most of my videos. A carer is someone unpaid looking after a close relative, friend, or neighbour, anyone I suppose, and they do not have to be hired by any service to do so. Carers are not care workers who are paid to perhaps do cleaning and maybe help with medication and so on. With carers, they tend to spend the longest time with the cared for or with their loved ones. Now in the UK, we have around 6.57 million carers up and down the country, some coping well, but I fear most are struggling. But why? Well, in this video I'm going to introduce perhaps a few tips, a few solutions on how this can be countered. This video is actually about speaking up and speaking out as a carer. So why speak up? Why is it important to speak up as a carer? I'm going to introduce some points on why it is so important for carers like myself and like yourself if you're a carer to speak up. What do I mean by speaking up? It's not just to sit there and expect things to change. You might need to get out there and help influence change. Here, first, are a few reasons why carers should speak out. Not every carer's experience is perfect, but if it is, then congratulations. You can provide compliments to a service. Now, I'm going to start with something rare, but it does happen, and if the health services are getting it right, let them know about it, because this is not an easy thing for them to do. We all know that the NHS, that being the UK's National Health Service, is under immense pressure. If carers around the country just give up, then that's it for the NHS. The health service is done for. So, it is important that us carers really compliment when the services are just getting it right. We can only hope that they seek to continue to get it right, because we know what happens when they get it wrong. And this is when carers most certainly need to speak up and speak out. Another thing to state why it's important to speak up is, do you not want to make a change, make a difference? As noted before, if carers just sit and take it and try to cope without pointing out what is going wrong with the support services or what is going right, then the services will just carry on regardlessly. I mean, hey, why should they change just for us, right? We carers will just get on with it. I mean, carers do not get paid, so why should they care? Well, deep down, I'm sure that every one of us carers do care. Why? Because we are carers. But we've got to let people know about how the services impact on us. You find you've got a rubbish carers assessment? Let them know. Found that a staff member perhaps ignored you? Complain. Is there a problem with the complaints procedure? Try and take this to management. I'm not saying that this is easy. Look, there are things that can even block carers from doing what I've mentioned, and that is another lesson for another day. However, the main aspect is I'm calling carers out to try and make that difference. And it is true, it will take time. It's not easy, but it's also not impossible. Your experience is worth more than you think. Now, it's true, Us carers are on a whole other level. Trust me on this. We are actually skilled professionals in the role of being a carer. We're not saying that we're skilled health professionals. That's something entirely different. But if you have been a carer for some time, don't you think, just for a bit, that healthcare professionals like doctors, perhaps social workers or care coordinators even, and nurses, cannot seem to understand the complex world of a carer? You see, your experience as a carer is worth more than you think, especially when health commissioners start designing healthcare systems and actually begin to worry about how this is going to affect carers in their region. Too much pressure on carers and those that they care for will end up unsupported. Remember, the health services depend on us carers, and anyone who says different has a lot to answer for. Sometimes services are bad. They will stay like that unless carers or mental health carers speak up. Things are bad for us carers. Listen up. Would you think we would need a law to protect carers' rights if things were going well? Now, I'm talking about the Care Act 2014. Carers' rights have been diminishing, and I suspect many areas still do not know about their obligations to carers. Must also take into account the large number of cuts to services heading our way. Now, if you do not speak up as a carer, how far do you think these cuts will go before they make your role as a carer unsustainable? What I mean is cuts to hospital beds, cuts to welfare services, cuts to carers' respite services, cuts to carer support services, cuts and closures of community centres, community hubs. Look, it does not cost anything to say, hang on a minute, these cuts are making my life a misery. They are making our community fragmented. So what are we going to do about it? Us carers need to speak up. Connecting with your local communities. Now, when I talk about connecting to local communities, it is not possible to usually speak out by yourself. In fact, it's not always a good idea sometimes. Unless you're able to blog like myself or make a video like I tend to do. You see, when speaking up, you may tend to go to a carer meeting or at your local care centre or perhaps a town hall or community group. But while you're there, notice who else is there. Who is there that is interested in backing and protecting carers? Are the health services engaging with carers? Are the mental health services out there wanting to hear from carers? Connecting with them, perhaps, or connecting with other carers? What do you notice? You see, weak brought together makes strong. Connect with the local community. Developing new skills. Okay, so speaking up and speaking out is not easy. We've established that. It takes time, but do it often enough, and it is a well sought after skill. You can gain confidence, make new friends. Perhaps learning how to be diplomatic about what is affecting your role as a carer or helping someone who is unable to help themselves. And I will cover this in more detail later on in this video. Raising self-esteem and confidence. Carers should not just take it. It's not right. We should not be just told to get on with it and be damned when things go wrong. Even just sitting in a meeting, you can learn a lot. As I've said before, it is not easy because we do have others who go to consultations and speak up for the whole group. And that's not a good thing. As if they were the only person in that room. However, there will be just a chance, maybe a small chance, when you slowly get that confidence and say what is on your mind as a carer. You deserve it. It is your right. Let no one take that away from you. I hope those tips were useful. I did draft such tips in a hurry, and I'm sure to add more later at another date. I could actually write a book about speaking up as a carer, but I know care organisations like Care Trust, Carers UK have produced material about speaking up as a carer or getting involved as a carer. In fact, I will actually cover something from Carers Trust's Triangle of Care in a moment, because I think they give some really good tips. However, so if you want to speak up about being a carer and how it's affecting you and your loved one or whoever you're trying to support or care for, how and where can you do this? Well, you're in luck. I will briefly mention where this can actually be done. Feedback. How was the service? This is one of the most easiest way to feedback about a service. Now, I'm a mental health carer, so basically, I'm going to want to feedback about a service aimed at me or my loved one. I mean, don't you find it strange that the CQC, that being the body that can inspect and rate mental health services, and yet it's not always so easy for carers to do the same? Still, there are forms provided to carers who visit an inpatient ward where a mental health patient or their loved one is staying, to feedback about the resources or about how they found visiting the ward. Like, was the staff friendly, and did you get your concerns addressed? Were you waiting long? How about family therapy? Was the service any good? All this data should go into measuring how good the service is after all. And it's not just useful for carers, it's useful for those providing the services. After all, if the data shows that the service isn't doing as is expected, then we all need to know that improvements need to be made. Another way to feedback is forms. Carers' views not only on services but proposals, e.g. service provision plans and strategies. It's not always about feeding back on forms. Sometimes as a carer, you might be expected to do a little research, a little reading. I'm involved at my trust, that being a mental health trust, and a few others actually. Now, I tend to go through some notes regarding service provision, but it would be foolish to say something regarding a carer's strategy or a carer's plan without some understanding of it. So if you're a carer or mental health carer like myself, you might want to ask your mental health trust or hospital what their strategy is for carers. Consultations, where a carer would attend in a group setting. Now, this is where care will be expected to go to a group setting. Hence, they'll meet perhaps other interested parties, usually other carers. Now, I sometimes attend what you call health watch or commissioning meetings, and they often would like carers' views regarding service changes or how a particular set of services has affected the carer's role. Now, if you're new to such meetings, do not worry. You're not expected to know it all. Speak to other carers who have attended that meeting and note down how it has affected you. Do not be afraid to be told that you are wrong. You know through your own experience. If they do not listen, well, you can only try. Carer groups. I would like to note that This is without a doubt one of the most critical and powerful aspects of speaking up as a carer. Now, as a carer, it is so important to find out your local carer centre. Sometimes you might not actually have a centre to go to, but listen, it's not unacceptable to go to another area nearby and try and get your carer's voice heard. Remember, it's about networking as well. Now, local carers groups tend to happen usually each week. They're fairly frequent, as I've stated before. It is not an easy time for carers, believe me. We should network. It is very important because the way things are looking, more pressure is going to rest upon those trying to support others suffering from ill health. So, alright, those are some of the places you can feedback. There are more like forums, filling in an online surveys, because you cannot expect to be everywhere at once. Also, attending special meetings usually held on awareness days, and much more. There are, however, even more ways for carers that can speak up and speak out, and that is getting involved. Now, I'm going to reflect on my own experience on getting involved at mental health services or my mental health trust. There are the hospitals that allow for those to volunteer or even get paid for their time, and I'm just going to go through this briefly. So let's have a look at involvement or care involvement. Attending business meetings and sitting on committees. Now, not an easy one to do. Do not expect to know what is going on straight away, because unfortunately the health service or the NHS is riddled with jargon. So much jargon that I bet it is hurting their own staff who cannot understand certain policies or procedures. A good example of this is a business meeting. And usually a senior staff member would invite carers along and ask them for their views regarding if a documentation is in plain English. Perhaps what you would call a reading group. Other meetings may regard views on services. Now, if you attend such meetings frequently, you will slowly but surely pick up exceptional meeting skills. Interviewing staff as part of a recruitment process. Do you wonder why some staff who are not so carer aware? It's like you can ask them what a carer is and they don't even know. Well, if you are involved in interviewing someone before they become part of the service, you can at least find out who is carer aware and who should be providing a service that affects carers, a service that affects us. Interviewing is not usually done alone. It would also likely be to be set on a panel, perhaps containing another member of staff or perhaps a service user if you're being involved in a mental health setting. Interviewing, again, is a skill worth picking up. Helping to design and deliver training for staff. Not an easy role to take on, and such a role can take some time to fulfill. I've done some training to staff myself, but this was down to knowing a fair bit about what service was being provided in the first place. I'd like to note that this is one of the highest role a carer can take, because this time they are not compelled to be speaking out, but they are now training health professionals or other carers to be carer aware. You do not even have to train, but you could perhaps facilitate a work group setting. Carrying out audits and reviews of different services. One of my favourite roles as carer, being on involvement, is you can actually carry out audits within perhaps an inpatient or ward setting or out in the community. You can really learn a lot about how services are run and also feedback what you found. What better way of getting heard when others also feedback their views and you are tasked with recording or capturing that data? Working in partnership with staff to deliver services. Now, some people can actually help run a service, and I'm usually, I'm going back on the mental health services again. I'm usually talking about peer supporters, link workers, advocates, and there's a few other roles. They all should go through some training, of course, but you can't be experienced. You can't beat it. And now I'm referring to those who have used the services. I'm referring to service users. And they have some understanding of the mental health services because they've gone through it. They've gone also through that experience of mental illness. But what about the carers? Unfortunately, the bad news is there is I would say, a massive lack of carers helping to deliver services. Now, I'm not talking about mental health services. I'm talking about those roles, as I'm saying, advocate, peer supporter, befrienders. And I think, I guess, I'm sure there's other reasons, but I suspect such mental health carers, or carers like myself, are very busy in their own role, providing that care. But if we do get to see more carers supporting other carers, then such a service would be vital to other carers, especially those new to the role. How to speak up. Know your role and why you are there. This is not a strict and hard rule, but it does help. It does no good to turn up to an important service provision meeting and just holler and make noise and complain about everything except what the meeting was held for in the first place. If you are there as a carer, you're more likely going to be giving feedback as a carer. Do a little research. Don't just turn up. Find out about what it's about in the first place. Again, it's not a strict and hard rule, but it does help. Now, a little reading on what is needed or what the organizer of that meeting wants. Now, to be honest, there are some very complex consultations regarding carer input, especially like commissioning strategies. And, there are times when the health service makes things so hard for everyone. But if you attend, give some idea of feedback or opinions, it might be gold dust to them. The more carers that turn up, the better it is for everyone. It's okay to learn. Sometimes it's okay to sit and observe. The lesser evil. I've been to a lot of meetings in the past, and I probably will continue to do so. Some meetings have been very good. I've attended them, everyone's got a chance to speak up. It's been fairly relaxed. Now, some meetings have not been so pleasant because at times I've often attended them and I hear arguments. Now, that's not always a bad thing, to be honest. The problem is when not much else is getting done. So sometimes it does actually pay to just sit, observe, and learn. There will be plenty of meetings regarding care input in the future, so please know who is chairing that meeting, know who your allies are, and who wants to make a difference while you're there. It is not okay to rant and take over. Hard for veteran carers, more powerful if you speak together. Now, as noted from the title, it's not okay to take over the meeting despite how tempting it is, especially if you've had a very difficult experience as a carer. And to be honest, you might perhaps be the most experienced carer there, and there are times when other carers will just sit back and be quiet, expecting you to do it all. But the problem is, if this continues, it means that you will wear yourself out. Plus, we should show respect to others who might have those important and good ideas. Let them have a word in. Work as a group, share input, and you might just find people will truly listen to what you have to say. Now, as I've mentioned earlier on in this video, I wanted to pick out some good examples about how other care organizations relay tips for carers wanting to perhaps speak up or get involved. Well, I'm going to refer to Carers Trust's Triangle of Care hints for carers wishing to get involved regarding their own strategy, but I think this is generic enough for quite a few other things as well. And as you probably already know, I'm a strong supporter of the Triangle of Care, and I'll always try and slip it in or even mention it because it's something that deserves to be mentioned regarding the welfare and support and cultural change of mental health carers. Now, this is coming from the Carers Trust's Triangle of Care Toolkit for carers, and as I said before, it gives some good advice. Now, from this toolkit, it says here, for those wishing to be involved, that being carers, regarding feedback on the Carers Trust strategy regarding mental health carers, carers should consider the following. And as I said, the reason I'm going to mention this is that it is actually good advice, not just for Triangle of Care, but for involvement as a whole. Now, what he's saying is you should be approached and involved as early as possible, provided with training, so you are able to fill your role, but also have the skills to articulate your own and others' experience in relation to how a service can develop and improve. Now, this is very important. There are times when a mental health service or health service can ask carers for input. But then if carers are not trained or empowered, then how can carers really feedback what is affecting them in their role, and how can this be incorporated into a sound and solid structure or system that will support carers? Also, what happens when carers are the last to be approached and the time to release a strategy is just around that corner? Well, it just seems almost like a tick box exercise, doesn't it? They spent all that time talking to everyone else, other commissioners, other health professionals, service users, and then the carers are the last to be consulted when it's just too little for them, or too late or too little for them to make any difference anyway. So that I found was a very important point. I'll go for another one. Recognize your role as experts, and don't be scared to cast a critical eye and ask challenging questions. And as I said again, this comes from the Carers Trust Toolkit for carers on the Triangle of Care. Again, this is good advice. It's not easy though. If you have been supporting someone for some time, you know your stuff. You are an expert. Don't put up with someone telling you that you're doing it all wrong. I mean, what are you meant to have done? You as a carer are told to just get on with it. Sometimes not even told that, and you get on with it regardless, because a good example is when your loved one's discharged without you even knowing about it. They turn up and you're scratching your head thinking, well, what do I do? Even worse, they're discharged and they're still unwell. So you just cope and it all goes wrong, and you know what? You get the feeling you're to blame, but why? Where was the support when you or your loved one needed it? Do not be afraid to ask those challenging questions. It is what affects you at the end of the day. Well, as you can see, if I can wrap this up, it's really all about carers' voices. It's not my voice, not only just my voice. If it's just left to just select few or one, or the experience of one carer or service user speaking up and speaking out about services, then eventually that person will be easily overwhelmed. It should not be left to the odd few working tirelessly to try and make that difference. It is vital carers take the spotlight off themselves, or those who are actually doing the work on speaking up, and recruit or try and get other carers who can often bring valuable insight and knowledge to the field. Now, I do understand that you're almost doing the carers organisations jobs for them, but I understand that they are under pressure themselves. Never feel pressured though to always get involved. I do feel speaking up and speaking out is critical as a carer. I think it's our duty to do this if you want to see a change in services or a change in culture on how carers are treated. But however, regarding involvement, I know it's a strange note to end on about don't feel pressured to get involved, because basically we all know carers work tirelessly at their role doing what is expected of them from a civilized society. Asking even more of carers who are not only sacrificing their time for the cared for, but also the services that can, at times, ignore the carer's experience. Well, anyway, I hope this video has been useful for you. Please check out my blog site and my other sites. I also have an online newspaper, a mental health newspaper that I've started up several months back, and it's still going on strong. It runs daily, possibly at times. I also have a podcast channel. But if you like the videos, subscribe. I'll try and release as many as I can. I know I do a huge amount of other things. I'm not just a carer, I'm a working carer, so I often my time can be filled up with what I do at work. And I hope to see you again soon, and good luck on your caring journey.